who's at the Kumasi Center for Collaborative Research. He's with us. He'll be helping us to understand, they actually conduct the test. Maybe they've submitted the daily incidence data and thus is in a position to tell us whether or not from where he sits, he thinks that Ghana is reaching the peak status. Dr. Owusu, thank you very much for joining us again. We had challenged your line earlier, but tell us, I'm sure you, working within the lab, have lots more information, and so you know that by now we should be happy as a people, knowing very well that we're getting out of it, isn't it, Dr. Owusu?
Yes, so I have listened to my colleague Emmanuel on the points raised, which are very important, significant things he has mentioned about what goes into a model and what will inform you to make a prediction. And every prediction you make is based on the quality of your data. It's the data that will inform you as to what to do. And you also realize that we have gone through a lot of difficulties for us and Noguchi in trying to clear a lot of backlogs. So there are two data out there. There is a data on when results are issued, and there is a data on when samples are collected.
Sure.
And there is a data on when lab results are also reported. So these are three things that are always churned out. So what you need actually is a data on the day on which the samples are collected. This is what is most important. Then you align that one to the laboratory results. When the whole exercise was starting, the framework of the data we had, more of when results are reported. So for the past 2 or 3 weeks, we have been working closely with the Ghana Health Service to try and realign all our data and point this to the date of sample collection, so that we'll be able to calculate the incident cases, the number of new cases that we record and or report every single day. This is what we have been working out for some time now. And we have not yet got to the point. So I'm not sure we have data of the daily incident case. We don't have that yet. I think that in the next couple of weeks, when we are able to realign our data, we'll be more confident to send this out to the Public Health Division. Then they can host it on the website for modelers to look at this and be able to model their data. So
Dr. Owusu, if we don't have daily incidence data, how come we're talking about reaching peak status?
Well, it's a bit difficult question to ask. From what I see and what I have observed, we do send data almost every day, but this data could be lagged behind, sometimes 2-3 days, sometimes a week ago, especially in the heat of the backlogs. And now that we have almost cleared the backlogs and Noguchi has almost cleared the backlog, you will expect that the data that will be coming from us ongoing will reflect the daily cases that come on the day on which samples are collected. So I think a lot has to go into this before we can begin to make prediction or talk about our peak times and when we are declining. So as my colleague said, the Director of Public Health may have more access information because the case investigation forms, surveillance forms are all sent to his unit. We only report results. I'm not too sure whether a team has entered all the case investigation form and have already realigned the data. I'm not too sure. But if that is available, perhaps it will be good for this to be hosted on the website so that modelers like my colleague Emmanuel de Graft can easily download this data and perform model. Let me just refer you to this. So there is a website that we call our human data website, which is a website that hosts almost all incident cases that are reported across the globe.
Okay.
So they pick their data from websites of different countries. If you look at them, they can tell you how many new cases Ghana is reporting. But this is based on how many new cases are reported on the website and not on when samples are collected. Even if you look at that, then you look at the trend of the data. It's not random. It is a bit erratic because you could have, for instance, on the 12th March you have 3, then as of 14th of April you have 70, and as of 30th of April you have 403, and as of 5th of March you have about 550. So it's difficult to use that to really tell your transmissibility in terms of the reproductive number to make any meaningful calculation, and based on that, make a prediction that indeed we have hit the peak and that things have leveled off. It's very difficult to use that data to really make any meaning. So I think that once the Ghana Academy of Art and Sciences are working towards it, we may need to perhaps give them some time for them to work through the data, to get fine details of the data, and then bring this out, bring the model, show this out to us, tell us what is happening, and if possible, host this data on the website, host the model on the website, show the graphics of what is meant by flattening, of what is the reference point for people to read into this, and then make it a part of us. I believe the public is much interested to see more of this, and then perhaps learn from this. So once such statements are made, I think that it has to be backed with evidence. And for me, because we don't see the evidence, this is why I believe the academic circle, people are worried that they don't seem to see the evidence of it. And if it's available, I think it would be very good for us to have a look at this. Then the modelers can also perform this exercise and then better inform us as to what is happening.
Now you made a very important point. I mean, while talking about the fact that, well, maybe the director has, the daily incidence rate and all, you also stated that it is difficult because of the, backlog, the lagging, daily testing. And so while you make, you send records daily, there's also the challenge of testing daily the number of cases that come to you. Doesn't that then tell us that nobody has that data now, and so the impossibility of the director having it and putting it out?
Well, it's difficult to preempt. We are only trying to speculate, but the director is in a good position to tell all of us. I believe.
But you also told us right now that it will be difficult to have the daily incidence rates because of the peculiar nature of our testing. That is not in doubt, because when we started, the number of samples that were brought to us daily were not all completed in that day, right?
Yes, I mean, you are right. Because of the difficulty we've had with testing and clearing a lot of backlogs and entering the realigning data, this is what we have observed, and not only for us, but also from our colleagues from Noguchi. It has been quite difficult trying to clear all these backlogs. Once the backlogs are cleared, we are in a position to now give more real-time data, which will match the date on which samples are collected. But as I said, the director is in a position where he has more access to information. He has a lot of surveillance teams who work on a daily basis. What we will encourage is that if these data are available, which we don't have, perhaps it will be good that it is made for all of us to learn, and then for the modelers to especially model these and inform us. But until that is done, I think that from where I see, from what I see and from where I sit, I'm not too sure whether this is available, which will mean that we must be cautious and quite careful trying to say that we have reached our peak and therefore we are trying to level off. A lot goes into reaching the peak, and a lot goes into level off. I mean, countries that have reached their peak and are flattening their curve have put in measures to lift their sanctions, because it means that the transmissibility of the virus in terms of the reproductive number is perhaps below 1. Okay. If it's below 1, you can begin to ease measures and begin to let people go to school, because you think that there is a constant growth rate of the virus. New cases are not coming. So you are at a certain area that you think is not so much of a difficulty. People can go about their normal duties. So if you mention flattening the curve, it has influence on the measures you take. Okay. So this is why it is very important. If you talk about flattening the curve, it has a whole ripple effect. If you tell you that action plan will have to change very quickly. But as I said, this primarily based on the quality of your data. If the data is not available, you may make a prediction 3 weeks behind, and you may be wrong, or maybe 6 months ahead, you still may be wrong. So I think that we need to be more cautious and then try and let the Academy of Art and Sciences do this work. And I believe that when they come out with a model and they get the real-time data, it will inform us more as to where we are as a country. And that can inform the government as to what measures to take, whether to ease measures, to get people to go to school, to allow social gathering and to increase the numbers, or to open the borders and let people come in. All this has some impact. So the flattening of the curve will have to go along all these lines, and it has a huge impact on public health action. This is what I think we need to know.
So